Let's face it, talking about erectile dysfunction, or ED, can be awkward. It's a topic that many shy away from, often due to feelings of embarrassment or fear of judgment. It feels very personal, and many men feel ashamed to discuss it. This silence can make the problem seem even more isolating. But here's the truth. ED is more common than you might think. Studies show that it affects a significant percentage of men at some point in their lives. It affects millions of men, and it's nothing to be embarrassed about. In fact, talking about it openly can be the first step towards finding a solution. Just like any other health issue, ED is something we can address openly and honestly. When we break the silence, we create a supportive environment where men feel comfortable seeking help. By understanding what ED is and what causes it, we can begin to remove the stigma and encourage men to seek help when they need it. Knowledge is power, and the more we know, the better equipped we are to handle it. Remember, you are not alone in this. There are countless others who are experiencing the same challenges, and together we can support each other. ED is a common problem, and there are solutions available. From lifestyle changes to medical treatments, there are various ways to manage and overcome ED. So let's break the silence, support each other, and take the steps towards a healthier, more confident life. Erectile dysfunction simply means that a man has trouble getting or maintaining an erection firm enough for sexual activity. It's important to remember that occasional ED is perfectly normal. We all experience times when we might be stressed, tired, or anxious, and these factors can temporarily affect our sexual performance. However, if ED becomes a recurring issue, it's essential to address it. ED is not a reflection of your masculinity or your worth. It's a medical condition that can be caused by various factors, both physical and psychological. Our mental and emotional well-being plays a significant role in our sexual health. Stress, anxiety, and depression can all contribute to ED. When we're stressed, our bodies release hormones like cortisol, which can interfere with blood flow and make it difficult to achieve an erection. Performance anxiety, relationship issues, and low self-esteem can also impact sexual function. It's essential to remember that the mind and body are interconnected, and addressing psychological factors is often a crucial step in managing ED. While it's true that the risk of ED increases with age, it's not an inevitable part of aging. Many physical conditions can contribute to ED, including heart disease, diabetes, high blood pressure, and obesity. These conditions affect blood flow and nerve function, which are essential for achieving and maintaining an erection. Lifestyle factors like smoking, excessive alcohol consumption, and lack of exercise can also play a role. Understanding the physical causes of ED can help men take proactive steps to manage their health and potentially improve their sexual function. Section 5. Occasional ED versus frequent ED. When is it time to see a doctor? This is a question many men find themselves asking at some point in their lives. As mentioned earlier, occasional ED is normal and usually nothing to worry about. It can happen due to stress, fatigue, or even after consuming alcohol. These instances are typically short-lived and resolve on their own. However, if you experience ED more than half the time, or if it's causing you distress, it's crucial to consult a doctor. Persistent ED can be a sign of underlying health issues such as cardiovascular disease, diabetes, or hormonal imbalances. They can help determine the underlying cause of your ED and recommend the best course of treatment. This might include lifestyle changes, medication, or other therapies tailored to your specific needs. Remember, there's no shame in seeking help for ED. It's a common medical condition that affects many men, and doctors are trained to handle it with sensitivity and care. It's a common medical condition, and doctors are there to provide support and guidance. They can offer reassurance and practical solutions to help you regain confidence and improve your sexual health. early intervention can make a significant difference in managing ED and improving your quality of life. By addressing the issue promptly, you can prevent it from affecting your relationships and overall well-being. So, don't hesitate to reach out to a healthcare professional if you're experiencing frequent ED. Your health and happiness are worth it. Section 6. Seeking help. You don't have to suffer in silence. One of the biggest misconceptions about ED is that men should just accept it as a normal part of aging. This belief can prevent many from seeking the help they need and deserve, or as something they have to deal with on their own. This couldn't be further from the truth. Seeking help for ED is a sign of strength, not weakness. It shows that you're taking control of your health and well-being. Talking to a doctor about ED can be the first step towards regaining your confidence and improving your intimate relationships. Many men find that once they open up about their struggles, they feel a sense of relief and empowerment. There are numerous treatment options available, ranging from lifestyle changes and medications to therapy and medical procedures. Each person's journey is unique, and a healthcare professional can help tailor a plan that works best for you. Remember, ED is a common issue, and you're not alone. By seeking help, you're not only improving your own quality of life, but also setting a positive example for others who might be struggling in silence. Take that first step today and reclaim your health and happiness. Section 7. Treatment options, a range of solutions for ED. The good news is that there are many effective treatments available for ED. Depending on the underlying cause, treatment options may include lifestyle changes, medication, therapy, or a combination of approaches. Medications like PDE5 inhibitors, such as Viagra, Cialis, and Levitra, can help improve blood flow to the penis. Therapy, particularly sex therapy, can address psychological factors contributing to ED. Your doctor will work with you to determine the best treatment plan based on your individual needs and medical history. Section 8. Reclaiming intimacy, the positive impact of addressing ED. Addressing ED can have a profound impact on your life, both physically and emotionally. By treating the underlying causes and finding effective solutions, you can regain your sexual confidence and improve your intimate relationships. Treating ED is not just about improving sexual function. It's about improving your overall well-being and quality of life. Section 9. Breaking the taboo. Talking about ED with your partner. While it can be challenging, talking openly and honestly with your partner about ED is essential. Communication is crucial in any relationship, and this is especially true when it comes to sexual health. Sharing your feelings and concerns with your partner can help reduce feelings of shame and isolation. It also allows your partner to understand what you're going through and provide support. Remember, you're in this together. Section 10. Your health, your life. Taking charge with knowledge and support. Erectile dysfunction is a common condition that affects millions of men. It's essential to remember that you're not alone, and that seeking help is a sign of strength. By understanding the causes of ED, recognizing the importance of seeking professional help, and exploring the available treatment options, you can take control of your sexual health and overall well-being. Remember, your health is your most valuable asset. Don't hesitate to reach out for support and